We are back with Dr. Makira Simmons Robinson from Cone Health Burlington Family Practice. We're talking about how you have healthy practices for 2025 and what needs to be on that checklist. So let's talk about this. Let's talk about staying a step ahead of those seasonal related illnesses, colds, flu, all that.
All right. So I think the number one thing that I would put on that list, getting your flu shot. Get your flu shot. Get the children's flu shot. Everybody get the flu shot. And again, you can get that at your primary care office. You can get that at the pharmacy. Number one thing, we want to try to protect you as best possible from the flu. And then next comes in the COVID vaccines, getting your boosters if you need boosters, the RSV vaccine if you're 60 years and older, and getting your pneumonia vaccine. I don't think a lot of my patients know about this, so they hear about it and they ask me about it, but I am a fan of the pneumonia vaccine as well. And we want to try to prevent you from getting those invasive forms of pneumonia that can cause you to be in the hospital, and we don't want you to have those complications. So staying ahead of it and trying to vaccinate for it is definitely my top priority.
All right, we've talked about exercise, we've talked about eating, we've talked about mental health, we've talked about making sure we make those assignments for our regular visits. Any other items that we haven't talked about yet but you think should be on our list?
So if you are smoking tobacco, if you're vaping, snuff, dip, any of those things, get that out of the way. That is not a part of the Healthy You 2025 picture. And letting your provider know, hey, I really want to quit these things. And allowing us to help you work towards that goal. That is one of the most powerful things you can do to improve your health, is getting those things out of the picture. So I definitely recommend that one. I tell my patients all the time, it adds no value to your health. So we can get it out of the way. I will cheer you on all the way. Other things I would add is just making sure you are taking your medications that you're prescribed as directed, and understanding why you're on those medications. We want to hear your questions. So bring your questions like, hey, I've been on this for 3 years. Do I need to take this forever? Just having those conversations and just being really clear. It's a good opportunity to do that now at the start of the year. And then I would also say making sure you're seeing your dentist, making sure you're seeing your eye doctor. We have a lot of systems that work together to make us us. So
yeah, it's interesting what the dental hygienist can tell you about the rest of your body, what the eye doctor can tell you about the rest of your body.
Exactly.
All right, a lot of people like to use technology, an app, a wearable device to improve their health. Fine by you?
Oh yeah, yeah, I love it. I love when patients come in and they show me their blood pressures. They have these beautiful charts and graphics. I love it. Use it to track your steps. Well, we talked about movement earlier. Track those steps. Let me know. Let me know. 6 months ago you were hitting this target and now you doubled it. I love to hear that. My patients use the devices and apps to track blood sugar. We can use it to just track like what were your levels for your cholesterol, for example, last year versus this year. Some devices will tell you if your heart rate's too high. They'll monitor blood pressure for you. Oh yeah, I love the technology and I love the reports that my patients are able to bring in, and we can make really good decisions based off of that data.
Okay, we have just under a minute. For someone just starting to prioritize their health, what's one thing they can check off today?
Today, getting that PCP, investing in a blood pressure monitor if you don't have one already, and yeah, I'll give you those.
Okay. Yep. We got to start small, right? So that we don't feel like we're overwhelmed. So we appreciate that. Thank you for helping us get on track and taking a look at that checklist. If you want maybe a family member, another loved one, to hear what she had to say, you can always find this interview in the To Your Well-Being section of our website. We're going to take a quick break, check in on the forecast.